Welcome everyone to this crucial discussion of life after intrauterine insemination or IUI. Today we have the honor of having Dr. Sathya, fertility specialist, Cloudnine Hospital, Nagar, Chennai, here with us. Thank you for joining us today, Dr. Sathya.
Thank you for having me.
So Dr. Sathya, for those who might be less familiar, could you please provide a simple explanation of what the intrauterine insemination involves and when it is typically recommended for couples trying to conceive?
So, intrauterine insemination, or IUI as it is commonly called, is a process in which the most motile sperms in a man's semen sample is extracted and injected into a woman's uterus during her ovulation period. Common indications are if a couple are married for about 3 years, having regular intercourse, not using any contraception, the female having normal fallopian tubes, the husband having a normal semen analysis, basically everything looking normal, but the woman is not conceiving. That's an indication for an IUI. Another indication is when the semen sample is good, the husband has severe erectile dysfunction which prevents him from having regular intercourse. The third is if a husband is infected with HIV or hepatitis and we don't want the wife to get infected. So we wash the sperms of the virus and inject these non-affected sperms into the uterus. These are some of the indications for doing intrauterine insemination.
Dr. Sathya, moving forward, could you shed some light on what physical sensations individuals might experience after the intrauterine insemination procedure?
IUI procedure is usually painless, but post IUI, some women may develop uterine cramps, which last for usually a short period, a few minutes at the most. The earlier days, when the sperms were not washed and injected directly into the uterus, there was a high incidence of cramping and high incidence of uterine infection. These have now become a thing of the past. And essentially, it's a simple, straightforward procedure. For some women, negotiating into the uterus is difficult. So we call this as cervical stenosis. If we are unable to put the tube with the sperm into the uterus, we can't inject this. We then have to use some mechanical instruments to open up the neck of the womb. And this may be associated with some pain post-procedure. Usually, there aren't any major side effects other than these.
Thank you for explaining that. One of the most common questions is about pregnancy testing. Can you tell us that when can one take a pregnancy test after an IUI to determine if the procedure was successful?
So usually we recommend a pregnancy test 16 days after the IUI. By then we should know whether a woman has conceived or not. And if the beta HCG, which is the pregnancy hormone, if that is showing a positive result, usually by 16th day, if it's in a few hundreds, then it's a strong positive test. You could also do a urine pregnancy test, but the blood test is more sensitive.
Patience is definitely a key in this process. Moving on, are there any restrictions for physical activity following an IUI procedure?
No, there are no restrictions. A woman can go to work, she can exercise, she can travel long distances. Basically, she can do anything after an IUI cycle. So there is no need for any modification of lifestyle following this procedure.
Thank you, Dr. Sathya, for providing clarity on what to expect after IUI. For our viewers, if you need more guidance or have any questions, please feel free to reach out to Dr. Sathya Balasubramanyam, fertility specialist, Cloudnine Hospital, Nagar, Chennai. Remember, patience and self-care are very crucial during this process. Thank you for joining us today.